Hello, welcome to Monetizing Innovation. I'm John Holcomb, the best-selling author of Creating Value Faster. Innovation isn't just the big idea on the whiteboard. It's the hard decisions, the missed signals, and the leaders who keep moving forward anyway. This show dives into the real stories behind breakthroughs in life sciences, healthcare, and tech, how ideas become results, how teams align under pressure, and how strategy turns into execution. If you're building something bold or looking for clarity to lead with confidence, you're in the right place. Well, today we're so lucky to be joined by Julia. Julia, would you like to introduce yourself to the audience?
And thank you very much for the opportunity to be on your podcast. So my name is Julia Komissarchik. My personal background is AI. I've been in AI all my professional life. I have a degree in mathematics from UC Berkeley, which is in California, and degree in computer science from Cornell University, and 10 US patents in AI. So I live and breathe in AI. And I'm also CEO and co-founder of a company called Glender. And that's what we're going to talk about it today, right?
No, absolutely. And, I think it's so impressive, right, with your background and your journey, and then also starting up Glender, because you're both the co founder and CEO. Could you share a little bit about the journey? Because, I think a lot of folks, we hear AI in the general sense, but there's way more than probably what the news actually shares with us.
Well, AI is a very interesting space, and I've co-founded several companies in various areas of AI.
Mm.
What makes this one is very, very exciting is that I get a chance to work with people who actually make a lot of difference in other people's health. So it is AI in healthcare. However, for us, what we're solving is slightly different than a traditional AI in healthcare company.
Mm.
We're not looking to develop diagnostics or triage. We're looking for is to solve this big problem in AI, especially AI in healthcare, and that is access to data. Because usually, like, chat GPTs of this world, they were trained on publicly available data, billions and billions of points. AI in healthcare doesn't have that luxury. Most of the data is highly protected and highly personal and not accessible. So that's the problem that we're solving.
That's fantastic, and I know, especially when you look at the regulated industry, right, especially healthcare and things like that, you really highlighted that challenge. So what are some of the things that you're having to do differently to actually address those specific needs?
Well, from the technology point of view, it's not that different from other works where AI in combination with quite a few different other techniques solves the problem, right? So
Mhm.
from technology, it's the same, but the problem is quite different in the sense that it's what we're trying to do is to solve this unpassable problem, which is in order to have models that are trained and are useful for almost everybody, one has to have access to data from almost everybody. But that's not possible. Most of the time, when we're talking about AI in healthcare, those models are trained on it's like a silo effect. Let's say the company works with a hospital, they train their models on that particular hospital's data. Unfortunately, that model will not be applicable to anybody else. It's non-generalizable.
Mhm.
That's the biggest challenge.
And when you look at that too, because that is a big challenge, right? And I think we're seeing it in other spaces of industry, but so I think there's a lot of parallels, right? Of this need to actually have the compartmentalized or somewhat siloed to be able to protect the data, but then also have that ability, right, to
Yeah.
broadly utilize. So how do you go about doing some of that or dealing with that challenge?
Well, that's the beauty of it, that it is possible to remove the sensitive portions in a lot of cases while preserving the rest. So, I'll give you an example. In certain cases, let's say it's behavior of a patient in a hospital. It's not the question of actually showing the person's face. It's a question of showing how they move in the room. And that means that if we de-identify the face or obfuscate the face, it becomes safer. But it actually depends on every different use cases have different challenges. But if that problem is solved, then hospitals and others are sitting on a gold mine. So it's sort of monetization, but on a different level, because it becomes the question of how to that data that the hospitals do have and that can be used for research if treated well, if treated correctly, if de-identified.
Absolutely. And I know some folks in the industry have tried the approach of digital twins and other methods. Are there methods that you found that are more significant, like you said, to be able to protect the patient rights, but still, access to the greater aggregate?
And that actually depends on also the type of data.
Hmm.
So a lot of times when people think medical data, they're thinking Excel spreadsheets, which is we are going beyond that. We're talking about X-rays, video, audio. All of this is very rich with information, at the same time, very dangerous as far as the identification of the patients. I'll give you an example. I just talked to you about video, but let's talk about audio. So,
Mhm.
where you and I are talking, I introduce myself. That's PHI. We would discuss what I was doing, etc. But it's not only what I said, but also how I said it, because our voices are recognizable. That has to be de-identified as well. Not only the sort of the names of myself and you have to be beeped out, but also the our voice needs to be anonymized. However, a lot of information is in the how we speak. For example, for mental health, for Alzheimer, whether or not there are pauses, emphasis, all of this, not only sentiment, but the prosody of speech, written stress and intonation give are all biomarkers, meaning they give information for healthcare. So they have to be preserved. So it's always like this balance between how much do I de-identify so that it's now not the person is not recognizable. At the same time, how do I preserve as much as possible so that it's used for research?
Absolutely. Yeah, and it is so fascinating because I do like your, concept, right, of monetizing the aspect of the data because there is so much data, right, that we've collected and especially from some of the expert, hospitals and things like that as well. What are some of the things that have been a challenge to maybe get the best access to the data and also make sure that it's able to actually use it in the way that you can monetize it the way you kind of mentioned.
It is all of it is challenging.
Mm.
That's why there are RBs, because this is sort of not a place where you can make a mistake, right? Once the data is out, it's out. There was also for a very long time, there was sort of a culture of why don't I just not share it? Safest way. Unfortunately, that doesn't work because we do need to share this data. Otherwise, the models that will be trained and applied to us will not be applicable to us. Like
Absolutely.
something which was trained in a hospital in New York City might not work or would not work well in a tribal clinic in Utah, in rural Utah. It's just basically different demographics, different presentation. So in a sense, we have no choice. We need to come up with solutions like that. But yes, it is dangerous because of the PHI, because of the laws which are in place for a good reason.
Absolutely. Well, and it's fascinating too because I know, you think about the U.S. and while our metropolitan areas have access to healthcare regularly, there's many places that live in medical deserts. So I
Mhm.
imagine the work that you're doing, especially with this data, really can help, right? Some of these other folks that are stuck in the medical deserts.
Yeah, that's the idea. But
Mhm.
the thing is that we don't ourselves have access to the data. Only the data custodians have. We strongly believe in this. We developed not a service, but something which can be a tool which can be used by the custodians themselves. But it's very important to work with rural hospitals
Mhm.
to help them monetize this data because it can be a revenue generator, going back to monetization, and also it can help build models that they will be able to use themselves.
Yeah, and I think that's so powerful. As you look at some of the challenges that you've worked through, where do you see yourself in the adoption cycle currently as you start pushing forward with this monetization of the data?
Well, it's starting to get more and more interesting in the space because, and the reason for it is very simple. AI in healthcare is sort of passing the stage of a toy to something which can actually be used. My favorite examples are models that are developed, for example, for mammogram that can detect vascular disease, or models that are developed for dental. Everybody has
Mhm.
dental x-rays, but it can actually show osteoporosis. So it's easy. That's why it's so important to look into things beyond just Excel spreadsheets, because those truisms like pictures worth 1,000 words. It is,
Yeah.
because it shows much more than just the initial, the quote unquote use case it was created.
Yeah, I think that's such a a great point, especially with medical imaging. It's come so far, and I one time when I was working in some of the imaging space, I had another gentleman say, picture's worth 1,000 words and a video is worth 1,000 pictures. And,
Yeah.
and it's funny because like you said, I mean, it's so rich in information, right? And then translating that information through the use of AI where it just wouldn't be possible to process some of that previously in terms of the richness of the information.
Yeah, we discussed the healthcare desert. So there's a small town in Utah. It has a museum. It's a mining town. They have one of the earliest X-ray machines. It's half of a room. Nowadays, X-ray machines are this big, so they can actually be taken to the places where there might not be even a specialist present, and those X-rays can be read by the specialist who is, on the other side of the world.
And that is so powerful, right? I think that paints the picture of what is possible. And I think that's where, it's funny. I think in the news, there's been a lot about, AI and the potential for jobs and things like that. But I think it's such a broad sweeping statement, that folks are getting lost in. No, there really is some great things. This is kind of we're on the frontier, right, of the
Mhm.
new industrial revolution with some of the work that you're doing at your company here.
Yeah. Well, all these AI will replace radiologists. No. AI can help with certain things. AI can do heavy lifting. AI can reduce routine. But at the end of the day, most difficult decisions, they're still humans.
Absolutely. And I've had a lot of conversations with folks around AI lately, and I think what you said just really triggered it. Is there it still needs to be human centric, and we still need
Mhm.
to have that critical thought where the human is actually utilizing the AI as the tool that it's intended to be, and not the other way around.
And also, right now, the responsibility is still the doctors.
Absolutely.
And it should be, because I love AI dearly, but I don't want to trust it with my life.
Well, and it's really powerful because if you think about, our healthcare system and a doctor usually only gets a glimpse of us, right? Even
Mhm.
a surgeon, they're getting a quick snapshot in time. And the powerful thing about AI is it definitely brings that ability to have a richer data set and also, help that, whether it's the doctor, surgeon, the caretaker, be able to get a more comprehensive picture of
Mhm.
how can we best care for this individual?
Yeah, that's why, the number of papers that do mention word multimodal increased significantly. And yes, that's very much like what we do as humans, right? We don't just rely on one type. We always rely on quite a few different ones.
Yeah, absolutely. And I think that's where it's easy to get lost, right? Sometimes in the conversation for the layperson that doesn't understand, right, the connections that have to be made and the work that you're doing to try to, help these, hospitals monetize that data.
Yeah. But at the end of the day, it's data that can be monetized, but also it's data that has to be treated very carefully,
Absolutely.
because it's not some publicly available internet article, right?
Yeah.
It's actually somebody's records, and those records are highly sensitive and unfortunately highly actionable if somebody gets like the wrong person gets the information.
Absolutely. And what when you think about some of the aspects of that, what are some of the challenges that you've come across, especially in terms of, doing the right training for the model or making sure that that data can be, shaped and morphed the way it's intended to be used?
Well, one of the things is that for PHI, just by the nature of it, because there isn't a lot of PHI that will be available for training, would it's not like other places where you just train one model for everything. It's a combination of quite a few different factors. But one of the things is the multimodality of it. So let me give you an example. If somebody sends you a screenshot, it might have, an X-ray in a DICOM viewer. It will also have maybe a photograph of the person you're talking to, and it could have some writing, and there also could be, some of the screens allow you to write on top of it. So it's not just one thing or another. It's a combination of all the factors. We as humans can handle this. Machines, if they're just trained for, let's say, de-identifying X-ray, it could like miss the photo altogether or miss their handwriting altogether.
Yeah, and I think that's such a great point, right? And we take for granted that sometimes, right? Just in the multimodal approach of our minds.
Yeah, and we shouldn't. It's an
Yeah.
amazing what we have is an amazing thing. I wouldn't dare call it a tool, but capability.
Absolutely, definitely a true gift. And when you think about just all the work that you've done today, where do you get the most excited in terms of where the future is going with some of the work that you're doing and where it could lead to?
Well, a couple of things. Like I'm a technologist, so for me, it's exciting to solve very very difficult problems. But from the business point of view, and more importantly, from overall point of view, what I really like the fact is that it potentially can help people who know how to help other people. And that's the kicker for me.
And that's so powerful, right? Especially when you know that it can enable, really a great progression, right? And
Yeah.
better care for folks and better outcomes.
Yeah, that's ultimately we're sort of one of the steps in the long chain, but ultimately that is great. That makes me
Absolutely.
feel good.
Absolutely. Well, and I think that's the motivation, right? That helps get you out of bed in the morning, and even if it's been a hard day, right? It's one of
Yep.
those things you can remember that this is what's keeping us moving.
Yeah, precisely. Because yes, startups and solving problems which are impossible are not exactly easy.
Yeah,
So yes, you're spot
exactly.
on.
Well, what are when you look at that, I imagine too that part of it is still human centric too, in terms of not just protecting the data, but I imagine trying to interact, right, with the different folks at the hospital, the different
Mhm.
access of all the touch points. Could you share a little bit of your experience with that and any key takeaways you might have?
Well, that's the interesting part, right? You're actually talking to people who are doing things. And that's what I like about what we are doing because our solution is ubiquitous. It's like it's like a water filter. Everybody needs it. As a result, I get a chance to talk to quite a few different individuals in terms of within the organization as well as different types of organization, and that's a lot of fun.
Absolutely. Well, and it's powerful because that's also how you learn, the different facets, right? Because this really is a multifaceted field. You have, the view from the physician, the view from the payer, the view from the hospital
Yes.
administration. Yeah,
And they do ask different questions. They sort of look at it from very differently. But that also helps with understanding what we're doing better and also understanding how to create product which will be a better fit for what they're looking for. Because, the underlying idea doesn't change, but how we present it and also the nitty gritty, the details matter.
absolutely. When you think about too, just like you said, you've actually started up multiple companies. So any challenges or key takeaways that you've transferred over the years as you've gone through that cycle of creating multiple businesses?
Being an optimist because it's hard.
I love that because that is so true, right? You have to be that. I like to call it kind of the student of the business, and you just have to accept that, hey, I've got a lot of learning to do, and I'm optimistic about the outcome.
Yes, that's for sure.
It's funny. One of the things I've seen too is, it's so important on that front end. I really am a big proponent of job theory because it helps give you that multifaceted, multimodal approach, right? Of okay, the customer's hiring, and I'm using customer in the loosest sense, right? It could be the patient, it could be the doctor, but they're hiring a solution, not necessarily a specific product. And when you think about that, it helps you step into that learning mode, right? And it really helps understand, okay, well, how are they using it? Because sometimes technology gets implemented, but the doctor or nurse was not involved, right? And then you
Yeah,
get
it's
rejected.
it's a very important question. Actually, I'm part of the one of the committees at SIM, which is Medical Imaging Society, and we did several rounds of interviews. And exactly what you were pinpointing, which is whether or not the doctor can actually use what was designed, has always been pointed out as one of the top reasons why something is not adopted. So if it was very interesting to see those conversations both with the people who design systems as well as the customers and how they are treating things. So if anybody has chance, I would recommend reading one of the papers that we published, and the committee is publishing another paper within a year. So
Oh,
I
that would be
recommend that.
fantastic. Yeah, absolutely. And I think again, those are some of the papers that are great because there's no need to reinvent the wheel, right? If you can take some of these good learnings and actually apply, uh, we can move things forward even faster.
Yes, precisely. Because we do speak different language. The guys at the bedside, the professionals, and the technologists do speak two different languages.
And it's so true, right? And I think also that's the importance too. Like you think about doctors and nurses, right? There's, very deep training and often specialized training that they go through. And so it, some of these tools, they're not necessarily top of mind for folks, but when they need them, they really like
Mhm.
need them. And
Yeah.
I think that's where it's really powerful. Some of the things that your company does to be able to help out in that field.
Yeah. Well, let's say if it's a hospital, if they do want to do some research on their patients' data, or they want to train those models so they can be used in that hospital, yes, then the identification is very important.
Absolutely. Have there been any other challenges in terms of that multifaceted sort of customer, I'm using that again in the broadest
Mhm.
sense, that you've had to face, especially as you've gone down this journey for Glendor?
Well, one of the things is that healthcare, by definition, is highly conservative in the decisions that it makes. So it's harder to be an innovator in that space just because instinct of everybody on the other side of the table is let's wait, let's see, let's make sure it works. And I can totally understand why they have that mindset, but it makes it for a more interesting conversation.
Absolutely. When I helped start up our drug delivery business, it was really interesting because you quickly found out, that there was a joke in the industry. Is like, nobody wants to be first, everybody wants to be second when it came to the technology that assisted the drug delivery, right?
Yeah.
Versus, the drug product, obviously you wanted to be first for market share, but
Mhm.
it's very true because those are some of the challenges. It's, the FDA process is drawn out, but then even the hospital and healthcare, and then over there, the insurance systems and the pay systems. Yeah,
Complicated thing, that's for sure.
absolutely. When you look forward, especially for some of the work you're doing at Glendor, what do you think? When do you think you'll hit what you would qualify as your success targets?
Well, that's hard to say, and also I'd sort of view it slightly different because success is in the eyes of the beholder, and also for me, if it's already done, that's stops being exciting. So I'm looking forward to the challenges. It's much more fun. The
Yeah.
road is much more fun than getting there. But in terms of the success, yeah, for sure, it's. I would consider it a success if the data custodians who are handling the data, including the patients
Mhm.
themselves, understand both the value of what they have, but also the dangers that sharing willy-nilly can create. Because especially when it comes to, for example, data about kids and others, because that data is there forever, has to be treated very carefully.
And yeah, absolutely. And and this is I think is always what's made this space so difficult, because even children's hospitals are largely, donor funded. And, with some of these rare diseases, especially when you start getting into, the oncology side of things, yeah, you're trying to protect, but you also want that data, to your point, to be useful to help the next child. And I know my daughter actually had thyroid cancer when she was 12. And, to me, it was a very interesting, aspect to deal with, right? Because you have the emotional force because, it's your daughter, but then you also get to like look at how are they taking care, of her? And then what data do they have available? How well is it researched? And at the
Yeah,
time, we were fortunate to be in a good area, thank goodness.
yeah. There's actually a sort of another interesting direction, more academic. HIPAA covers certain things, but there are certain other things like sensitive images. For example, in pediatrics, sometimes oncology patients have to have full nudity photographs. Those photographs become attractive to the wrong side of people. So it's very important to make sure that the treating physician has access to the data, but nobody else has.
Right.
Like not janitors, not somebody who's scheduling because they don't need to.
Exactly.
And there was actually a very interesting paper I was fortunate to be a co-author of, which was on sensitive imaging. This is like an invitation to conversation. What else should we cover? Because it could be nudity, it could be even mammography in certain cultures, or like gruesome pictures, like car crashes, etc. So all of this also needs to be thought through as sensitive and protected. So that's another paper I would recommend people read. It was very interesting to write it, but it also raises a lot of challenging questions, especially
Absolutely.
in pediatrics.
Absolutely. And that's something too that I think you bring that rare perspective too, right? Of being able to have both that academic view as well as then, the industry entrepreneur view. And, especially then also working, like you said, with some of the various organizations too, and leading some of those, it really gives you a different perspective, right? And you're able to leverage to be a translator and a thought leader at the same time.
Well, I try to. I try to be.
Absolutely. I was talking with another colleague, and that was one of the things we talked about is the importance of academia, and the role because there's a lot of work in academia that it is more, there's greater rigor, right, and a lot of
Mhm.
excellent thought given to some of that, and then it's that partnership with industry, partnership with government, that really, the three kind of have to come together to really drive true success.
And also, I would think individual
Absolutely.
patients.
Absolutely.
Yeah, that's a very important component.
Yeah. No, but I just have a lot of respect for the work you do, especially the fact
Thank
that
you.
you can help bridge those various groups. It's a great place to help influence the future of healthcare.
Hopefully,
Yeah.
hopeful.
Yeah, absolutely. Are there the things too at from our discussion that we haven't touched upon yet, but you'd really like to highlight for the audience, especially with your innovation journey and future direction?
Well, one thing which I would encourage is for people to think about AI, because if we don't make, if we don't think through this, somebody else will make a decision for us, especially when it comes to in healthcare. But we touched upon this. Basically, it's a question of how to make sure that the models that are being trained are trained to represent us, individual us, right? And at the same time, so that when it's used, it's also used responsibly. So, and that's something that has to be decided by each individual as well as the organizations as well as the government because it's something like we as a society have to pay attention to.
And I think you bring up such a great point there too, because, AI has such great potential as a tool for us, to really leverage, but that, we in some respects have gotten a little ahead of right where are some of those boundaries, right? And as society, where do we want to draw those?
And we need to think through those for sure.
Absolutely. And that's where again I think some of those relationships become so important, right? When you're able to bring in both academia, industry, and the government. It takes time, right? Because that's a big group of influencers. But yeah, I think that's where creating the right policy at this point is really important.
Right, but we also don't always have enough time to for them to get together. So
Yeah, exactly.
so that's why I encourage everybody individually to also think through this because as I said nobody can do it for us.
Yeah.
Or if we do, we won't like the
Yeah,
results.
yeah, exactly. No, I think that's such great advice.
Thank you.
Was there anything that you would really else that you'd like to help make sure that we cover, especially as we are nearing the end of our discussion here?
Well, if anybody has questions, please go to our website. It's glender.com or connect with me on LinkedIn. It's easy to find me with my last name because, I'm always interested in having those conversations and seeing if we can help.
No, that's fantastic, and we'll make sure to put that contact information in the write up so
Mhm.
that folks can reach out to you.
Thank
I can't thank you enough, Julia, too, for sharing your insights, and it's real. I think also really your positivity, right?
you.
Hey, these are problems we can solve. It will take time. It's not overnight, but
Yeah.
really appreciate you sharing that though, and really being such a great thought leader in this space.
Thank you very much for having me here on this podcast.
Well, thank you so much. I will look forward to hopefully having you back again soon, and we'll continue the dialogue.
Likewise.
All right, take
Thank
care.
you.